Hi, I'm Stacey Rose. I'm an infectious diseases doctor here at Baylor College of Medicine.
Hey, I'm Mike Wren, and I'm a family and community medicine physician here at Baylor.
Hi everyone, my name is Masih Ahmed. I'm an eye surgeon at Baylor Medicine.
And I'm here to answer some of the most common questions about infectious diseases.
I'm here today to answer the most common family medicine questions.
Today we're going to answer the most common questions related to the eye on the interweb.
Okay, so I just peel back the first one. Let's see. What do infectious diseases doctors do? We do a lot of fun things. It's kind of the best specialty there is. We treat patients who have infectious diseases. So sometimes that's a chronic infection like HIV or hepatitis. Sometimes it's an acute infection like a staph infection. And sometimes it's the kind of infection that no one else can figure out, which is what makes our jobs really fun. We're kind of the detective doctors. So if somebody's been having fever for 3 months and no one knows what it is, they might send them to an infectious disease doctor to kind of try to sort it out. There's infectious disease doctors that are also really important in public health, so places like CDC, Centers for Disease Control. We also do research. There's a lot of infectious diseases doctors that are trying to figure out the next vaccine or cure or prevention method for the next global pandemic. So we do a range of things.
All right. So for us to start, what's family medicine versus primary care physician? So essentially they're the same. For primary care, it's usually a mix of pediatrics, internal medicine, and family medicine. For me, family medicine, I see everyone from infants to geriatrics, and for internal medicine, they mostly see adults and geriatrics, and for pediatricians, they mostly see kids.
Why do eye doctors blow air on your eyes? Well, I hope the eye doctor is not the one literally blowing the air on your eyes, but the device that some eye doctors will use actually measures your eye pressure. So the air comes out as a little puff, bounces back, and the measurement from that tells us what your eye pressure is. And that helps us check for things like glaucoma to see if that's something that needs to be treated in your eye.
Next is, let's see, drum roll please. What causes infections to smell? This is another good one. It depends on the infection, but a lot of times it has to do with the microorganism that's causing the infection. So, for example, anaerobes, which are a class of bacteria that don't actually require oxygen in order to survive, they tend to have the worst reputation for being smelly. So anaerobes can live in our gut and in our mouths. So sometimes people that have really bad gastrointestinal infections or really bad dentition can have a bad smell because of anaerobic bacteria. But lots of other organisms can have a smell too. I actually remember when I was in training that they used to tell us that Pseudomonas, which is a common gram-negative bacteria, causes a smell that is similar to wet corn tortillas. So like a good Texan, I can recognize Pseudomonas as the smell of wet corn tortillas.
What's the reason doctors still use pagers? I think they're cheap, they're reliable, and they get good service in the hospitals, which the cell phones don't always get. Usually if it's an urgent call or something urgent you need to respond to. Otherwise, nowadays with electronic medical records, you can just send messages via Epic.
Let's see. Why do eye doctors numb your eyes? Well, that's actually another really good question, and it's related to the first one. Depending on the type of device we're using to check your eye pressure, we may numb your eye so we can actually tap on the eye. This allows us to get an actual feel for what that pressure is in the eye, and that device is called a tonometer.
All right. Let's see. Next question is, what makes infections get hot? Okay, this is a great question. So you may have noticed if you ever have an infection, for example, on your skin, like maybe you have a bug bite that then gets infected afterwards and it might become warm and red. A lot of times that's really not the infection driving that sense of heat or redness, but actually your own body's response. Just like you become red and inflamed when you have an allergic reaction, when your body is revving up the immune system and sending in different proteins and cells in order to fight an infection, that's what tends to cause the inflammation, which then makes it feel hot to the touch.
What does it mean when doctors say stat? It means stat, urgent, ASAP. You need to respond to it immediately. So I'm primarily outpatient in the clinic, so I don't hear the word stat too often, fortunately. But on the inpatient hospital floors, it's used a lot more commonly to get a quick reply.
All right. Why do my eyes feel dry? That's a really good question. I think the answer is because you live in Houston. But our eyes feel dry for one of two reasons. Either we're not making enough tears, or the tears we're making aren't good quality and they evaporate quickly. So especially when it's hot outside and you have the air conditioning on inside, or when it's cold outside and you have the heat on, that can really dry out the air and make your eyes feel dry. So a good quality tear is one where you have a good layer of oil in your tear film. The oil keeps your tears from evaporating, and we all have oil glands that sit behind our eyelashes that are secreted and help keep that tear film on the eye as long as possible.
All right. Next common question is, what makes some vaccines hurt more? With vaccines, there's a few different reasons why when we get a vaccine, it might hurt. One is the carrier, the chemicals that the vaccine is in when it gets injected, right? Because you're not only getting injected with the part that's working, sort of the active ingredient, but there are other inactive ingredients as part of the medication that's being injected under your skin or into your muscle in order to create your body's response against that protein. And so sometimes just those chemicals can be irritating to the body and can cause some pain. But again, it comes back to this inflammation and what your body is doing. So sometimes it's not as much to do with what's being delivered to you in the vaccine as much as it is your body responding to it. And as your body is getting activated in the way that it should to respond to the vaccine, that's really what we want to do, that reaction can actually be painful.
What is considered too much poop? That's an interesting one. The main thing to look out for is any change from normal. So normally, if you're going once a day, and then all of a sudden you're going 3-4 times a day, that would be a big change and something to be considered, and maybe you should go see your physician. Conversely, if you're only going once every 3 days and then all of a sudden you're going once a day, that would be something concerning as well.
These are some good questions here. Wonder whose Google search page this is. Why does my eye twitch? I get asked this question all the time, and the most common answer is eyelid twitching usually doesn't mean anything bad. Our eyes can twitch when we're not getting enough sleep, when we're not eating properly and we may be lacking some nutrients. Usually it goes away over a short period of time and may even be related to something like your eyes dry or irritated. If it's something that's staying for a longer period of time and you have other neurological symptoms with it, you can come see your eye doctor and we can check it out for you.
All right, and the last question here is, what causes a fever to be bad? You know, it's really interesting. People think of fever as something bad, right? Because it's quite uncomfortable and makes us feel ill. But like many cool things about the human body, there's a reason for fever. So our body is what generates the fever. It's really not necessarily the infection itself that's releasing chemicals that make us hot. It's that our body, as we're trying to fight off an infection, releases chemicals like interleukin-1 and interleukin-6, just trying to sound fancy, these chemicals that will rev up our body and actually increase our body temperature. But that increase in the body temperature then helps to kill the organism. A lot of times the microorganism can't survive that higher temperature. And so it's literally one of our defense mechanisms for killing the infection. So fevers don't feel good, but they're probably good when you're trying to fight infection.
This is the last question. Maybe it'll be as fun as the last one. What does it mean if your pee is cloudy? Similar to the last question, you want to look for changes from usual. So if your usual urine is a certain color and it changes or it becomes a different consistency, it may mean a urinary tract infection, or you're peeing out stuff that you're not supposed to, like proteins or sugars, that kind of stuff you want to keep in your body. If you notice that, it's really easy to go to your doctor's office and get a urine study.
This better be the best question of the day. Why are glasses better than contacts or vice versa? I think that's a matter of personal opinion. Glasses and contacts can both play their own role depending on what the situation is. For instance, glasses can be worn for as long as you want and can be very stylish accessories as well. Contact lenses, on the other hand, can give you a better field of vision, especially if you have a higher prescription, and can help treat conditions like dry eye and be worn when you're playing sports or doing other outdoor activities.
Happy Doctor's Day to all the doctors out there who are doing all that they can each day to provide compassionate and competent clinical care.
Happy Doctor's Day to all the doctors out there. Thank you for what you do.
Happy Doctor's Day. Really privileged to be part of such a great group of doctors here at Baylor Medicine.